So the biggest tool we took from this was how important it was to educate the patient. A lot of our referral sources are previous patients referring their friends and family members. So when we're finished with them and they are discharged, we try to educate them about joint derangements or dysfunctions or just the MDT assessment overall, and even into the other category and how we can treat and identify what is going on with the patient and then how to tailor their treatment based on what classification we place the patient into. We have a lot of our previous patients that will call and say, I have this friend, they are scheduled for surgery or considering surgery. Do you think you can assess them? And what we always like to tell our patients and anybody that calls the office to ask us that is at least let us assess. Within 3 to 5 visits, we can determine if you have a mechanical problem, sometimes even less. We identified that on the very first day with this patient. She walked out the door knowing that she was a hip derangement and didn't have the symptomatic hip osteoarthritis. That did not change her outcome, but really, letting the patients know there is no harm in the assessment. Worst case, you still go and have the surgery because that's what your choice was and you felt like you had access to that, and in the United States you can get whatever you want. So she was able to do that. In some other countries going through the medical system, I don't think she would have ended up possibly on the surgical list because she didn't, or at least she'd be way low down behind a lot of other people that did have more functional deficits. So I think it's just the accessibility is almost too easy for a consumer who doesn't necessarily understand what's going on. And I feel she was taken advantage of by that.